Peptides are everywhere right now, in your Instagram feed, in your doctor's office, and probably in someone's medicine cabinet that you know. But how much of it is hype and how much is actually backed by science? Today, I'm sitting down with functional medicine practitioner Elizabeth Tringali to get the real story, the good, the bad, and the ugly. Hey there, and welcome to the Cinnamon Effect podcast. I'm your host, Kimberly, and I'm thrilled to have you with me on this vibrant journey of discovery and growth. This podcast is your go-to space for embracing intention, where you'll find clarity on your unique path, deepen those meaningful connections, and unleash your creativity like never before. We'll explore how to build unshakable confidence and celebrate the beauty of gratitude, all while savoring the calm that consistency brings to our lives. Thank you for being with me. Let's sprinkle a little cinnamon into your day and make life sweeter, healthier, and more fulfilling. Welcome to the podcast, Elizabeth Tringali.
Thank you so much, Kimberly, for having me again. I'm so honored and flattered, and I love speaking with you. I could talk to you all day long, so it's always fun.
I know. We see each other a lot, actually, but today you're here. We're going to talk about peptides. I feel like I know that you are an expert. We were talking about this, that you have been using peptides since 2018,
yes.
Right? It's been a while.
Yes, and it changed my practice. I randomly, it was serendipity. I was at A4M, the American Academy of Anti-Aging Medicine, and I was taking a course on mold, and the speaker was drinking a Diet Coke, and he really just turned me off, and he didn't seem to know his slides, and I was like, oh my God, this guy's terrible. So I went out, complained, and they're like, well, go into the workshop next door with Jim Lavelle, who I love. He's a genius pharmacist, naturopath. So I just popped my head in, and it was about peptides, and I'm like, it was like Christmas. I'm like, is this true? Are these little tiny amino acids that send messages and signals throughout the body real? I didn't believe it because it sounded too good to be true.
Yeah.
It sounded better than hormones and better than what we use for neurotransmitters in psychology or psychiatry rather. So I started implementing what I learned, and I got my certification. So it took a year. And at that time, they weren't really doing a lot of virtual because it was before COVID. Mm-hmm. So I had to fly to all these different places to learn about these cutting edge therapies. And then I started implementing them in the office, and people thought I was crazy. But I was getting such great results. They thought I was crazy because they'd never heard about it.
Yeah.
But I usually am an early adapter with things. Mm-hmm. Hence my
You're very cutting edge. Yes.
Because I'm always trying to make myself better and optimize my patients and look what's safe and what's therapeutic. Mm-hmm. And these little guys, these little amino acids, they're very safe and therapeutic. So it was perfect.
So what was the first peptide you started using and prescribing?
Honestly, it was thymosin alpha because I see a lot of autoimmune. Mm-hmm. And that one was super safe. It was FDA approved, so it had already gone through all these rigorous trials and studies, and it had been out, and you really could do no harm with it. And it modulates the immune system, and we make that peptide. We actually make it from the thymus gland. And as you age, so the thymus gland sits behind the breastbone, and it helps your T cells, your immune cells that fight infection. And as you age, sometimes the signals just don't work anymore, and the thymus gland actually atrophies. And so your immune system after puberty really decreases. So people will have more antibodies and autoimmune issues. And so that peptide you can use to modulate the immune system to give signals again to stop attacking, say, like your thyroid tissue, for instance, with Hashimoto's, and attack the foreign agent that is causing the inflammation in the first place. So I started using thymosin alpha, and I started seeing the antibodies go down in autoimmune disease. So I love that. And then I incorporated BPC 157, which is all the rage. And that was another very safe peptide. It's 15 amino acids, originally made from gastric juice, so again, we make it. Now they don't get it from gastric juice. That would be gross. They get it from a lab, right? But it sends a signal to heal. And it helps your vagus nerve. So that's the nerve that controls, it's your communication highway between your gut and brain. It helps with tendon injuries. Again, great for autoimmune. I would use it to help get people off reflux medications. Most people nowadays, when I do stool testing, they have leaky guts. BPC is a great peptide for that. And what I like about that peptide, you can do it orally and you can do a shot. They do a little different things when you do it orally. It's more really just working on the gut microbiome. Mm-hmm. But when you do a shot, it's more systemic and it's working for injury injuries and healing and regeneration of tissues and things like that. So those are the first two ones I really started using.
Yeah. And I feel like there's kind of a lot of controversy about BBC 157.
Absolutely.
People are saying, and a lot of this we're getting on social media. And as I was saying to you, is like, at first social media seemed very peptide positive. And now it's kind of flipping to this negativity online of like, where are you getting these peptides? BPC 157 causes cancer, tumor growth.
Right.
So do you want to talk about that?
Yeah, and there's no studies proving that, which is annoying. But in 2023, the FDA came out and said, hey, we want more research on these peptides. So they classified them as a category 2, which meant the compounding pharmacies, the pharmacies we use, can no longer make them. So it forced patients to get them in the black or the gray market, which is online from like their trainer, and it's a research chemical, and there's no oversight at all. So it did a disservice to us, especially those in functional medicine and integrative medicine, because we were prescribing these with oversight. We were using a 503B or 503A pharmacy where they're able to make a compound in your name it's an FDA registered pharmacy, which means the FDA can come in anytime and check their sterility and check the accuracy and make sure what they are saying is in the peptide is actually in that vial. Is it really BPC, or are you giving some sort of like fake saline or just garbage, right? So they changed the regulations, and it made it so difficult for people to get. So then there's a lot of controversy, and people are saying, hey, be careful, this could cause cancer. The reason they say it could cause cancer, and there's actually no research showing this, is BPC promotes healing. It helps increase your growth hormone naturally, and it promotes something called angiogenesis. That's when you're making new blood vessels to help heal and regenerate tissues. So the theory is that if I'm making these new blood vessels, this angiogenesis, am I feeding a tumor? And there's no research showing that, but there's no research showing that it doesn't either. So I never write that drug or prescribe that peptide rather for anyone that has cancer. And we actually have an integrative oncology physician in our practice, Dr. Eric, and I refer all our patients to him. But there are certain peptides you can use in cancer, and there's ones that you really shouldn't, even though there's like no law saying do not use this. It's just, why would you, right? So like in cancer, there's a really good one called PNC 27. And again, because of the 2023 regulations, we weren't able to get that anymore, even though, again, there's no adverse events with it. Thymosin alpha, FDA-approved peptide, we weren't able to get it. So we wonder, was it big pharma pushing for them to recategorize those? Because again, there was very few, if any, adverse events in the literature. But regardless, now in 2026, they're reclassifying them, which is a good sign. It means they're going to do more research, and they're going to release those for the compounding pharmacies to make them again safely with oversight from the FDA to make sure that we're not causing any harm.
So interesting. Yeah, because if you restrict and people are still trying to get them, then you're going to have these other weird places sprouting up like on the internet. So can you get peptides on the internet?
Yes, anyone can
willy-nilly,
yeah,
right?
You can, and that's not safe, in my opinion, because you do not know what you're getting. So our compounding pharmacies, one of my friends is a colleague, he actually purchased from a very famous company, I won't say, but a very famous online company. I think actually they were just recently shut down. And he said they were pure, so that made me happy at least. They were getting something sterile, because God forbid you inject yourself with something that like a prion, which can cause like a neurological disorder or something. So it was sterile. But he said it wasn't the right dose. It was much lower than expected. So people are expecting to get the right doses. Again, there's no guarantee. There's no transparency. And you can't even get the certificate of quality that they may give you could be made in their garage, like on a printer. Like you can't, there's no enforcement, there's no oversight. No one is checking to see what these compounds really are. So people were forced to get these, and you can still get them now. They're called research chemicals. So that's why it's so important, in my opinion, to see a functional medicine practitioner. It doesn't have to be me, but just someone who is licensed, who's been doing this, and maybe not even necessarily a med spa, someone that's like really focusing on doing no harm, helping your body, not just doing something willy-nilly. They took a course, in 4 hours, and now they're certified on it. Like really, they dug into the literature and understood the pathways and understand the biochemistry to make an impact on your health, to benefit you.
I think, in my opinion, I would never I would never take a chance on trying to dose myself and eat, and take a peptide without having someone look at my blood work and my whole health picture. So I'm surprised that I'm just shocked that people want to go that route.
It's
right.
Social media.
Yeah.
And you've got all these biohackers that have no degrees in anything in science, but they look good. Like these women, like a lot of times, or men, they're bodybuilders, they look great. And they're like, this peptide does this. And they're just rattling off all these peptides. And then patients come in and they're on 5 peptides, which, how many signals can your body take at the same time? We don't know because it's not being studied. But they're like, it's not moving the needle. What's wrong with me? Well, they haven't done the work. They haven't cleaned up their system. A lot of people are still eating a lot of fish, which I love fish, but it's tainted. There's a lot of mercury in fish if you're doing wild fish. And if you're doing farm fish, you've heard me talk about this, you're getting a lot of PCBs and plastics and pesticides and antibiotics from the way they raise the fish. So it's very difficult if you're eating fish to have a clean microbiome or a clean plasma. And so a lot of these bodybuilders are saying, eat a lot of fish, get very lean. They're toxic in metals and plastics and pesticides, and then they're not going to get the result from the peptide that they're getting. And who knows if the peptide they're getting is even real, because there's no guarantee, there's no oversight. We have no idea.
Yeah. Okay, so let's talk about the most popular peptides. And first of all, I'm wondering, why are they all like letters and numbers? Why don't they give them a name?
They do. They're just abbreviated. So because you don't want to remember like the long chemical name, like the GLPs or glucagon like peptide. Like who's going to say that?
Yeah,
so
we would never remember that.
GLP-1,
Yeah.
right? So it's just their long chemistry names a lot of times. So it's easier just to say like BPC-157. They changed that now to like a pentadecacetic acid. Let me look that up real quick. Pentadecapeptide arginate. Like, who's going to say that?
Too complex. Okay, so that's the reasoning for that. Okay.
Right. So PDA replaced BPC when we couldn't get the peptides anymore in 2023. We were allowed to change one of the salts in that amino acid sequence. They used a salt called arginate. And so instead of using the body protection compound, which is BPC-157, they used something called PDA. And, do you really want to say pentadecapeptide arginate?
Yeah, no.
So it's just too long.
That's what I'm on. Yeah.
Right.
Okay, that makes sense.
Yeah,
that makes
it's just
sense.
so long.
So BPC-157, obviously the semi-glutides, the TB500, right?
Tirzepatide, right? That one I think is the most commonly prescribed one now.
Oh, really? That's tirzepatide.
Yeah, so that was Mounjaro and Zepbound, but the compounded version. So the compounding pharmacy I like because you can change the dose on those. So plus it's a lot less expensive. Like if you don't have diabetes or sleep apnea, I can't get Zepbound covered for you, even if you're overweight, but your BMI it has to be greater than 30, your body mass index. So we can get it compounded for you for things off-label, meaning it's not studied for just lowering your inflammation or helping you with autoimmune disease or brain fog, which tirzepatide absolutely does. And it lowers cytokines. So if I'm lowering the inflammatory messengers in your body, everything works better. So it's probably one of the most prescribed peptides in our practice. And I've been practicing on my own for 11 years in my clinics, but practicing medicine for 27 years. So this is like a blockbuster peptide, is the tirzepatide. And again, the compounding pharmacies are making microdoses. So I can give you like a milligram of it, or 2 milligrams of it versus starting at 2.5. And honestly, a lot of times I start at 0.25 milligrams or even 0.05, like micro doses. And when you use those doses, which again, you can only get compounded, you can't get it from a regular CVS or Walgreens pharmacy. But at those microdoses, you're still changing the inflammation in the body, helping the signaling for the regular hormones to work better. So like it'll make your perimenopause patient less inflamed. And because I'm lowering the insulin and taking away that food noise in their brain, like I'm hungry all the time, help me, Elizabeth, that's what they say. And I'm taking away that food noise with just a low dose. All of their hormones will be more optimized because if you lower insulin and you lower how much sugar people are taking in, everything works better in the body.
Interesting.
Yeah.
So you are using tirzepatide for someone maybe who is not overweight, but has autoimmune issues.
Yes.
Interesting.
Yes, you'll see the antibodies come down because, again, I'm lowering inflammation. You'll see focus and memory will improve because even people that are thin may have issues with glucose, insulin, sugar. So I'm waking up that insulin receptor and making it work better. And so they'll have less brain fog. Plus, they're opting typically for a healthier diet, typically, because they're not in the back room seeing those donuts and saying, I have to have that. They can look at a donut now and say, you know what, I don't need that because that food noise is quieted from the GLP and the GIP, the two peptides in tirzepatide, whereas, say, semaglutide. Semaglutide is just a GLP-1, so it's just a peptide that works on making you feel full. So it has a little more side effects with like nausea and heartburn and indigestion because it actually slows down gastric emptying. So I personally don't love that one as much as the combo, which is the tirzepatide. So that's working on the same thing as semaglutide, so you feel full and you're not hungry and slow down gastric emptying, but it also works on insulin sensitivity. And that's the jackpot. That's important because if you're waking up that receptor for insulin, you don't need as much food, you're not hungry all the time, and you're less inflamed. They're even showing that these peptides, semaglutide and tirzepatide, are lowering the risk of 10 out of 13 obesity-related cancers. Like, how amazing is that? And I'm not seeing any negative side effects except for things like nausea or constipation. And I do want to talk about the muscle loss, because people always ask about that. So in the studies, they actually, especially with the tirzepatide, so that's the Mounjaro and the Zepbound studies, they actually increased skeletal muscle and increased bone density because their insulin was being signaled properly and they weren't resisting it. So insulin's a hormone that when you eat something like a carbohydrate, your insulin senses, okay, I need to get that into the cell. Your pancreas makes insulin and it says, okay, I have to get that sugar, that carb into the cell and utilize it for energy. When you have insulin resistance, which is, I would say, more than half the population right now. It's like most of my patients, even skinny people. So when you have insulin resistance, the sugar's hanging out longer in the bloodstream than it should. The insulin is building up, and that's a fat storage hormone, by the way, building up in the system. And then that's causing things like heart disease, dementia, diabetes, of course, but any kind of inflammatory condition. So if I'm waking that receptor up with a peptide, a signal to say, hey, work better, you don't make as much insulin. The sugar gets into the cell, you have more energy, but the sugar is being utilized by the muscle better. So you will build muscle. Does that make sense?
Interesting.
Yeah. And of course, you have to be eating the protein. So if I'm just eating pretzels all day or rice and carbs, sugar,
or drinking
sodas,
coffee, a lot of people just drink coffee all day.
Coffee all day, not having any protein, of course you're going to lose hair and you're going to lose muscle. But if you're actually paying attention and trying to get it, I'd say, people want to have like a gram per body weight, so like if you're 120 pounds, they want you to get 120 grams of protein. That's a lot. That's hard to do. That's like 3 big pieces of chicken a day. Like that's a lot for us to have. Yeah. So I'd say try to at least get like 75 milligrams. And honestly, if you're balanced and you're taking amino acids or drinking electrolytes with amino acids, you can probably get away with less because honestly, I probably do that, not intentionally. It's just it just happens because I'm busy all day. I don't have time to be eating my chicken all day long. Excuse me.
As you're seeing patients.
So
I get their chicken leg.
Right. It's just, I don't know the time to do that, but I want to. I just don't have the time. So the point is, I have preserved muscle, and I see this with my patients. I just had a patient yesterday. She's in the health field. She works all day in surgery, so she doesn't have time to eat all day. Like I was saying, she probably gets 50 grams of protein. She was worried because she's moving right now. She's like, I'm not working out, and I've been on this peptide microdose, so 5 units of tirzepatide, which is like 0.05 milligrams. It's nothing. Anyway, she's like, oh my God, did I lose muscle? Did I lose bone density? And I have a really fancy scale, as you know, the Tanita scale. I like it better.
I love that scale.
I like it better than
I wish I had that scale.
Well, you can come anytime.
Okay.
But anyway, I was like, oh, let's see. I don't know. But she was taking her supplements faithfully and her amino acids faithfully, and she was always getting a protein shake in. And again, I'd rather you have food, but if you're a busy person, sometimes you just don't have the time, which is terrible, but it happens. It's real life, right? Anyway, long story short, she gained 3 pounds of muscle. She lost 2 pounds of fat, and she actually gained 0.2 pounds of bones. And we're like, this is amazing.
Wow.
So if you use it and you're taking your micronutrients and you are at least trying to get some extra protein in and not going just for like pasta or bread or a donut or pretzels or whatever in the break room, you'll build muscle on these. And so I really want people to be aware the social media is saying, oh, you're losing muscle, you're losing your hair. Yes, that's if you're done doing it improperly. And you need your provider to check your thyroid because when there's less of you, so say you lost 20 pounds or even 15 pounds, your dose on your medications or your your thyroid medication may be off. You may not need as much. So that can cause side effects for like hair and muscle as well, because that could make you all of a sudden hyperthyroid, which is an overactive thyroid, versus hypo. So it's very important when you're taking these, you're not just getting it randomly. Who knows what dose you're getting when you're getting it randomly, and are you even getting the right prescription or the right agent, peptide, have someone monitor it and check your blood, because things change.
Things change. Now, what about the people that say, well, are you going to take it forever? Are you going to be on that peptide forever? Are you going to prevent your body from making those peptides on its own? I think that's like a big fear.
Yeah, that's a great question. So the peptides don't do that. Pharmaceuticals can do that, but peptides don't shut down your ability to make hormones. So for instance, don't let me forget to get back to that point about tirzepatide and being on it for life. Like, so growth hormone, prescription growth hormone given to people who have a true growth hormone deficiency or used by bodybuilders all the time. That is a drug that it's called Omnitrope is one I can think off the top of my head. It tells your pituitary, do not make any more growth hormone. And it is a peptide, but if I'm using a peptide like Semarelin, Tesmarelin, CJC, Ipamorelin, those are called secretagogues. And what that means is it's giving a signal to your hypothalamus to make your own growth hormone. And that's what I love about the peptides we prescribe. We don't like to use the growth hormone for that reason. So it's like a negative feedback loop, just like testosterone. If I give you testosterone, especially your perimenopause now, if I give you testosterone now, it's going to tell your body, don't make it, I'm getting it elsewhere. But the peptides generally don't do that. The peptides are optimizing your ability to make your own hormones. And that's why we like BPC, because it's actually telling your hypothalamus to make your hormones again. Even Epitilion, I don't know if you heard of that one. That's a really good one for sleep. But it optimizes your hormones. So tirzepatide makes you feel full and semaglutide, right? And it helps the insulin work better. But if you stopped it abruptly, and those peptides, our body makes them. It's natural. It's identical. Almost identical to what we make. They changed the amino acid sequence so it lasts for a week in the body versus having to take a shot every time you eat. But long story short, you're making that peptide. If you stop it, you just go back to how you were before, being hungry and, having more regular bowel movements again. And your insulin eventually wouldn't work as well unless you really dieted, exercised, and work on that receptor. But I tell you, I've got patients that have been trying for years to get their insulin, their sugar, and their hemoglobin A1C down, and they can't on their own. And when these peptides came out, it really was like a game changer. So my point is, and my long-winded rant.
No, but you're such an expert on this, so I love your rant.
You're not shutting down your ability to make it. You're still going to make it. You're just not going to be as optimized as you were on the peptide.
Could you yo-yo, though? I mean,
if you stop and start,
swing?
Yes, you're going to yo-yo. But
you could swing the other way and gain
but back
weight.
to where you were. Just like if I put you on a great diet, 1,200 calories, high protein, low carb, and then you stopped and all of a sudden went back to eating gummies and M&Ms, you're going to gain weight too. Or, I don't know, that big diet like Slim Fast or, keto diet, anything. Even if I stop working out, I'm going to gain weight, right? Yeah. So you're changing the homeostasis in the body. But it's not like stopping those drugs are going to make you gain weight. It's what you're doing that's going to make you gain weight. If you can still, I know if I'm not taking my tirzepatide, and I say at lunch, I have a wrap. Normally, I have a half a wrap and I am satiated. If I'm not on the peptide, I'm still hungry. But I know, usually a half a wrap of, some organic chicken wrap or something, a half a wrap really fills me up. So I'll tell myself, okay, I'm training my brain. I don't need that second half, because it's probably 1,000 calorie wrap, honestly, if you look at it. I don't need 1,000 calories at lunch. I need 500, 400, maybe 250, whatever. But if I'm on that drug, I already feel full. If I'm not on the drug, I'm training my brain. I don't need that much. So you have to just listen to your body and know what your limits are. Especially if you're not working out that much. You don't need that many calories, especially at my age and menopause. And I'm sitting behind a desk all day. It's not like I'm running around and exercising all day. Then I might need those calories, but really I don't. I probably need 1,200 calories to maintain for me, maybe even less, unfortunately.
Wow. Yeah.
Because I'm missing those signals for metabolism. That's why I like the MOT-C. So the MOT-SC is a peptide that makes your body think you're working out when you're not. Isn't that so cool?
That's wild.
It's an exercise mimetic. And so I took that during COVID. Did I ever tell you the story?
No.
I love this story. So I had COVID. I was really, really sick the first time in 2020 or 2021. I can't remember. It took me out and I was not working out at all. And I'm like, oh my God, I'm going to die. I don't have any muscle left. I can't even walk the dog without being short of breath. Like,
wow.
I really was that sick. Well, I had the MOTS-C and I was taking 25 to 50 units every other day. It took me a few months to get back into the gym at that time. And when I did, I was able to lift the same, which was beyond my understanding. I'm like, how is that? And I was still good with my cardio. And here I couldn't even walk, when I was so sick with COVID. So it targets the skeletal muscle. It helps your body use insulin properly, kind of like tirzepatide does. And it helps you with insulin resistance. It helps you use glucose properly. But it tells the mitochondria to make ATP. So COVID and a lot of inflammatory viruses and cancer and diseases, things like that, they take out the mitochondria. And that's your body's ability to make energy, but it's a signaling little organelle, a little organism in our cells. And if it's shut down and not giving you the signals for metabolism, you're screwed. Right? So the MOTS-C is a really good peptide that helps target that skeletal muscle, helps your metabolism, helps all your hormones, and preserves your muscle. It's pretty cool.
So a lot of these sound like
miracles.
Yeah, too good to be true, like miracle solutions. I mean, what about doing this all like the old-fashioned way?
Oh, I mean, that's what I did for years. Yeah. It's a lot more work.
Yeah, it's a lot more work.
You can absolutely, I don't think you can. So doing the old-fashioned ways, I used to do bodybuilding before all these peptides were big. Like they were out because they've been out since the 70s and Russia had been using them forever. And they're like military programs. And probably most likely they were using them in the Olympics. That's why they probably, that's probably why they had a competitive edge. But regardless, they developed a lot of the peptides for the military. And anyway, so I used to do bodybuilding. That was like, 2013, 14, and I was competitive and I didn't have any peptides. So I had to bring my meals. I had to make sure I was weighing my food, weighing my protein, eating every 4 hours, and really being very tight with my nutrition and taking a lot of creatine, glutamine, amino acids just to maintain my body and my physique. And then I had to take more thyroid hormone because I was working out way too hard and it was too stressful. I had to take more adrenal supplements. And I actually wound up tanking my thyroid and I was getting all bloated and swollen. So that was annoying. I was hurting my kidneys because the amount of protein I had to consume to look sculpted and perfect. And then when these peptides came out, I didn't have to do all these crazy things with supplements. So the old-fashioned way for bodybuilding is not necessarily the right way because if you look at bodybuilders' lab work, their liver is usually a mess, their kidneys, and this is not everyone, but I'm just saying a lot of the bodybuilding people that I was seeing right before a show specifically because they're just looking good. They're not optimizing like their organs, right?
Yeah.
So doing the old-fashioned way, not necessarily, you're not going to be doing it the right way, but now, knowing what I know, not using the peptides, it's difficult in menopause and perimenopause because you're not getting the hormones to signal the way they used to. So without a peptide, it's going to be handfuls of supplements and very strict diet. With the peptides, your diet doesn't have to be quite as strict and you don't have to take as many supplements at all, which is really nice.
Very interesting take on that. I've never really heard anybody describe it like that. So it's interesting.
That's what I lived and that's what I see with my patients.
And you've kind of done it both ways.
Yes.
And so you're seeing how you can optimize both ways. I do always think like with you, if there's a question, like you've tried it.
I've done it, yes.
It's not like someone who sees you that you are not doing all of these things yourself.
Absolutely.
You are absolutely trying them and you've got your own real world feedback. And obviously you do a lot of research and everything too.
Yes.
But
yeah, I think most people in our industry, right, they're kind of biohacking themselves.
Yeah.
Most of the functional medicine providers I know, we're all trying it because we're all excited. I have a really cool story about BPC and my husband, he hates when I tell his story, but so
hey Terry,
I know, sorry honey, I love you. So like 4 years ago, I hear a thunk like at 3 or 4 in the morning, like hard thunk, and like my heart dropped because it didn't sound right, and he wasn't in bed with me, so I run over. He's in the bathroom. He's conscious but unconscious, like he couldn't look at me. I never told you this. I'm like,
no.
So he couldn't look at me. He was like looking off to the side. His head was like on his shoulder because he couldn't hold it up. And he's kind of grunting. I'm like, oh my God, he's having a heart attack or a stroke. Like, I didn't know what. And he was unresponsive. Like, I'm talking to him. He couldn't say my name. So I ran to the kitchen. I called 911, of course. Ran to the kitchen. I got my vial of BPC and a couple syringes, and I just pumped his stomach with like 2 mLs. So high dose of BPC. Like, you could honestly give a whole vial and it wouldn't hurt somebody, but it protects the heart if you're having a heart attack, and it actually helps with neuroinflammation if there was a stroke. And remember how we were saying how it helps the blood vessels and helps angiogenesis. So did 2 pumps in there. Within 5 seconds, he was alert, awake. He was looking at me. He's like, what are you doing to me?
Oh my God. What was happening to him?
So we still don't know. We took him to the hospital. He did the $1 million workup, for cardiac, neuro. They kept him overnight. We did tests after. We couldn't really ever figure it out. But I had learned from an ER physician in my training on peptides that if there's anything cardiac or neurological going on, you give BPC immediately, because this woman, her son was in a coma from a car accident. And so she snuck into the hospital. Sorry, sometimes we do these things. A vial of BPC, gave it IV, and he came out of the coma. And it decreased his cerebral edema tremendously. Now, I'm not saying that it saved his life, but I think it really did move the needle for sure. Mm-hmm. And I can tell you firsthand, it helped my husband, because unless it's coincidental, either way, that's how incredible that BPC peptide really is.
Wow.
So incredible.
That's pretty crazy.
Yes. So now I travel with it. I have a little peptide carrying case. You can get them on Amazon. And I always have like my little syringes, and it has my name on it, or Terry's name, whatever. And I carry a prescription just in case, because if we go overseas and they want to confiscate it, that's never happened. Every time I've gone overseas, it never happened. But just in case, I say this is prescribed, this is personal use. I'm not trying to sell it to you over there in Greece, whatever. Yeah. But I'll bring it with me, and that's never happened again. But I have backup just in case, So I want the listeners to know, like, that's a really safe and hopefully like life-saving peptide. If hopefully I can help somebody with that information.
So interesting.
But obviously call 911. That was the first thing.
So that leads me to another question, which is it more efficient to take it in an injection versus taking it as a pill versus taking it as the little strips that dissolve?
Hands down, injections are the best. Okay. You're absorbing 100% of whatever you're putting in. There are certain peptides that don't get destroyed by the gastric juice. Mm-hmm. So like BPC is one of them. But when you do it orally, it's better for what you're working on in the gut microbiome. When you do a shot of it, it's going to be more systemic, like with my husband. Like, it helped his brain immediately, I believe. Mm-hmm. Or if I have pain, like if my neck is hurting, sometimes I'll just shoot it right in my neck, but not into a blood vessel, like into the skin. It's a subcutaneous, tiny little insulin needle, but it's going to be systemic. And even on GLP-1s, when patients have they have heartburn or they have the nausea, I'll have them do a BPC shot, and it instantly goes away. So it's that fast when it's a shot. When it's oral, it's a little slower. Yeah. I have another funny story about BBC. So my nurse at the time, years ago, she comes in, she looks all sad. I'm like, what's wrong with you? She thought her pig was dying because he couldn't poop for 4 days. And pigs are like a ton. Like this is a huge, huge pig. So they're going to have to put the pig down. I was like, oh my gosh, give it 4 or 6 caps of BPC. I was like, just go give it to him. So she did. It pooped the next day.
Wow.
And so that's how quickly they're going to kill this poor little pig because it couldn't poop. And they thought it was a blockage. They thought it was a tumor. But it turned out the husband was feeding the pig the rinds of the pineapple and not cutting it up. So pigs are able to eat the pineapple rinds, but he wasn't cutting
like
it.
Anything,
yeah,
right?
Exactly.
Yeah.
And apparently those are good for him. But he was just giving him big slabs of it instead of like chopping it up. And it caused a little blockage. But the BPC helped with gastric mobility and helped that pig go to the bathroom.
Oh, so my goodness.
Oral absolutely works, especially for that pig. I love the GHK-Cu shots.
Yes,
but they burn.
So talk about those, because that's supposed to be really good for skin, hair. What else? Skin and hair.
Cartilage.
Okay.
It's actually really good for immune modulation too. So it's sending signals to certain genes to tell the immune system to work better, which is amazing. No one ever talks about that. So I like it in mold illness too. And I will see people, because I do my crazy scale on everyone, I'll see people increase lean mass on just GHK-Cu. But usually think of skin and tendons and cartilage, connective tissue, that kind of stuff. So the shots are much better. The sublingual tabs that I I use Instamed. They work. They take a little longer, and they're definitely not as strong as a shot. But for someone who's needle averse, like they work. Some peptides, when you do them sublingual or liposomal, I believe Quicksilver has a line out now, they work. They're just a little slower and not as potent, but they will work. But certain peptides aren't great orally. I'm trying to think of one. Like we used to use sermorelin, which is a growth hormone, secretagogue I mentioned earlier, so it makes you make your growth hormone. I would give that as a troche. And it would barely move the needle when I would check labs. I check insulin, like growth factor 1, and that's like your growth hormone marker. And maybe it'd go up a few points. Like, so it really wouldn't. But what's interesting, oral BPC would increase that growth hormone marker in the blood. So it just tells you, like the oral, even though it's a troche, and troche is absorbed in the buccal mucosa. So when you absorb something, when you put something in between like your cheek and gum, you're bypassing the liver and absorbing it in the mouth. So you think, okay, it's going to have great absorption. Sometimes it works, sometimes it doesn't. So sermorelin, not so much.
Should you stuff it in that part of your mouth?
That one, an Instamed, they say you can just leave it on your tongue or under your tongue. But like a troche, like from a compounding pharmacy, is between the cheek and the gum. But one that works great orally, I took it this morning for your podcast, is dihexa. Dihexa is a great peptide for your brain. It helps with memory and neuroplasticity. And it can help increase, I can't make a claim, may increase your IQ, but it helps with focus and attention. So I take it.
So you are on point this morning.
I'm trying.
I know you are, of course.
But I love the oral version of that. And so that one actually works. And you can compound that. But actually, there's an over-the-counter one that we sell that works great by Healthgevity. It's called Neurogevity. And I feel it pretty instantly. But I want people to know, like, you have to be optimized for these things to work. You want to make sure you don't have a lot of chemicals in your system. That's why we like to do detoxes, right? And you want to be eating healthy and having the right micronutrients. So if you're deficient in certain nutrients, your hormones, nothing's going to work like it should. I could put you on the best estrogen in the world. You're not going to get the signal, to make your skin look better or to help with vaginal rejuvenation if you're low in things like zinc or B12 or folic acid, or B6 or something like that. So you have to be optimized.
Everything first before. You can't just say, I'm going to get a peptide and I'm going to start it and not have any clue what else is going on in your health.
Right. I mean, you can. You just may not get the same results. And the younger people generally will, because they're more optimized than someone in their 50s, right? So if you're in your 20s, you might actually get some really good results because you're still healthy and young. But as you get older and accumulate more toxins, it doesn't work as well. So perimenopause, menopause, gentlemen in their 40s and 50s, we like to detox them first. So, that can be saunas, foot baths, detox shakes, different supplements, anything with like N-acetylcysteine or watercress or artichoke helps your body detox. Swedish bitters are great. I like to go when I'm out and my husband's having a cocktail and I don't want to drink, I will do soda water with bitters because they used to use that in the bars. Do you know about this?
Yeah, you talked about this on our previous podcast.
It works.
And I was like, oh my gosh. And I still haven't done it, I don't think. But I need to try that.
Just soda and bitters. It's great for digestion, but it's also helping you detox because those bitter greens that they're using in that tincture that they put in your soda water is great for detox. So there are expensive ways to detox, which we do in the office because sometimes the little things aren't strong enough. And if you're really toxic and you have a lot of plastic in you, I don't think just taking N-acetylcysteine or glutathione or alpha lipoic acid is strong enough. But I have a gentleman right now, he's in his 30s. He went to a couple hormone clinics and they couldn't get his testosterone right. And they already had him on like a super physiological dose of testosterone, crazy dose. And I was like, okay, let's see what's going on with you. So I did a toxic panel on him. I did something called the Toxic Zoomer, and it shows solvents, plastics, BPA, pesticides, heavy metals, mold. It shows everything that you can possibly test. And the guy was loaded, like 3 pages of toxins. So I did a plasma exchange on him, and then his hormones were so much more easy to balance. I got him off the testosterone.
Wow.
And that was huge because he'd been trying for years.
I thought once they take the testosterone, you can't come off of it.
You can. It's just it's difficult for you to make your own. But we got his up naturally now to 800, and he came into the clinic, and he, as soon as I stopped the testosterone just to see what was going on, he was in the 200s. So he is able now to go up. But the dose that the clinic had him on, his level was 1700. A guy's testosterone should never be that high. ever. Like that's just crazy, and it makes their blood thick, and they make too many red blood cells. They're at risk for strokes, and you don't. Even though testosterone is great, it's a brain hormone. They're actually studying it now. I read an article that it actually helps prevent glioblastoma.
Wow.
A study which is a brain tumor. So there's great research. Like I love testosterone. I'm not saying don't take your testosterone, but don't just because it's good, a good amount, a physiological dose. Don't overdose and take a crazy amount because you like how you feel with your sex drive and you're getting gains in the gyms. There's other things we can do.
Yeah. Well, there's also like these clinics that are more like med spa type things that are prescribing. I don't know. I just think like,
yeah, and then, they have you on a program. You every month you get your hormones shift. They check your labs, maybe if you're lucky, twice a year. And then I see the labs they check because I get those patients when there's a problem. And I'm not saying they're all bad, but they're not even checking like pathways. They're not checking how are you metabolizing your hormones. You really need to know how are you breaking it down. Is it going down this cancer pathway? Like if they're not checking a urine test for that, or even just checking something called estrone, which is a bad form of estrogen or toxic form if it's too high, then they don't know if what they're giving is actually hurting people. And that's our goal is not to hurt you. We want to optimize you. We don't want you on all these things. And our goal is to try to get you off some stuff. But first I have to kind of like load you up, detox you, put you on the micronutrients you're missing, and then we can start taking things away.
So one of the questions, I opened it up on social media because I said I was talking to you today, and what were some questions from people? And honestly, I got handfuls of questions from women that are perimenopausal that just said, where do I start? Where do I start with peptides? Where would someone start? I think it's very overwhelming, obviously so much information on social media. So where does somebody start?
Yeah, it's very patient specific, right? Because it depends. Your issues are not the same as someone else's. But if you're not sleeping and you're losing muscle, I would start with something like, and if you're getting belly fat, I like tesmorelin, which is another FDA-approved peptide that was originally studied for HIV positive patients to help them with lipodystrophy when they actually were getting like too much fat in the belly and not enough muscle on their arms. And so I really like that peptide for menopause because it helps you sleep, it builds muscle, and it targets belly fat. That one's a little pricey, so if they can't afford that, sermorelin, which we talked about a few times now, same thing. They're both secretagogues. They both are telling your brain to make hormones again. You make growth hormone, and growth hormone is a master hormone. It's a signaling hormone telling all of your other hormones to optimize, to heal, to build bone density, to build muscle, to burn fat, help you sleep. So that's probably where I'd start with most people. So like a growth hormone secretagogue like those. A lot of perimenopausal women have insulin issues, and they're starting to gain weight. That happened to me in my 40s during my bodybuilding days. All of a sudden I started blowing up, and that was, 2013, 2014. So I didn't really understand perimenopause then because they didn't really focus on it as much as they are now. Thank God they are. So I started blowing up, and I started developing insulin resistance. So then I really started starving myself even more and exercising even more, and that did not work. So that's when I would use tirzepatide for those people. When semaglutide first came out, I used that more in the menopausal women because we didn't have the tirzepatide yet. But I really saw meaningful change when the tirzepatide came out. And the perimenopausal people, they just felt better, they could sleep better, their joint pain went away, they were less moody because when you have insulin issues and cortisol's affected, your adrenals are affected, so you're kind of like having highs and lows. So it just kind of keeps them level. And as you know, I do a ton of blood work. I'm so sorry about that. But,
a lot of blood work.
I'm so sorry. But I have to see, and I want to see. I'm not just doing it to put you on things. I need to see what's changing in perimenopause. And a lot of, again, I had another patient yesterday. Her doctor, she's 42, and her doctor said, I don't check hormones at your age because they're fluctuating so much. Her gynecologist said this. And I said, honestly, I do agree. They do change every day because your labs today are going to be different than they are in a week or even a couple of days, who knows. But you have to get a baseline, and you have to keep checking it every few months to see, are you going closer to menopause? Are you going further away? Are you still making estrogen? Because then I'll give you a different peptide. I might give you a peptide like gonadorelin or kisspeptin, which optimizes the hormones. So depending where you are there. Or I might just use some herbs. If you're having mood issues with perimenopause, I might just give you saffron or a rhubarb extract that actually helps you make estrogen. Or I'll use a supplement called Ovarian Restore, which has, this is so gross, it has desiccated ovaries from a New Zealand cow, but glandulars, you hear about that on social media. People use glandulars like Armour thyroid, NP thyroid. Those are glandulars, so it's giving support to the organ that needs it most. But besides peptides, supplements will still help those perimenopause women. So I'll use those supplements.
Can you still, if you are on hormone replacement therapy, you can still do peptides as well?
It's going to make
goes
it
hand
work
in hand.
better. Yeah, it's
Okay.
not going to hurt your HRT. It's going to actually make it's better. It's going to optimize it because it's HRT hormones are signaling, right? They're just bigger. They're bigger chains or bigger molecules than peptides are just amino acids put together with a bond. So they're smaller than proteins. They're smaller than neurotransmitters. Generally, they're smaller than hormones, but some hormones are peptides, so that's confusing. But either way, they're just like little messengers kissing the receptor saying, hey, do this, wake up. You know? And if you use it with the estrogen, it's going to make it better, or the progesterone or the testosterone. But another thing that's huge in perimenopause is your skin, right?
Yes.
It changes fast.
It changes a lot.
Yeah. I read an article recently that in menopause, so 5 years after menopause, you lose 30% of your ability to make collagen, like 30%.
Wow.
And then each year after it went down something like 2%. So I like to give the GHK-Cu perimenopause to help build that bone density, help build the collagen, help build the muscles, and give you some of that elasticity back that we're losing
Yes.
so fast.
Now, what did you say about peptides? You should take them, is it 3 months and then take a month off?
So that's like a rule of thumb in our world, and that's how I was trained. But there's really that's why we want more research. There's no study saying this is what you should do. They eventually, since it's a signal, eventually the receptor kind of adapts to that signal and stops working. So you want to rotate them. So in general, things change the body. That's why we do blood every 3 months. Your red blood cells replicate every 90 days. So we generally will say, okay, in 3 months, let's stop this peptide and switch you to something else, or just take a break. And let your body wake up again and not just get used to the same signal to grow hair, make your joints feel better, and lower inflammation. If you keep using it, they just may not work as well, and then you're wasting your money. You know, another big waste of money, now that I'm talking about wasting money, are those combo peptides. Like, people love the Glow. Have you heard of that?
I think so, yeah.
The Glow and the Clo.
Okay.
And so that's the beauty peptide, the GHK-Cu with thymosin beta, which is good for muscle regeneration and healing and collagen as well. It's really good for the heart. And then they'll have BPC in it. So they'll have those three. And sometimes they'll add KPV. So they'll have 4 peptides stacked in one. And yes, I love that because it's fewer sticks. You're like, how many sticks can you do in your belly fat? I can't do it anymore. I have to do my tush. But you're losing stability because each one of the peptides has to have a different pH for it to stay stable. And the peptides are very delicate. That's why we have to keep them in the fridge. You can't leave them out. So if I'm putting the GHK with the BPC and the thymosin beta all in one, and they all have different pHs, within a few days of opening that and using it, you're going to have oxidation and you lose the integrity of that peptide. So you'll still have results, just not as good. So you're kind of wasting your money. So it's better to do them individually.
Okay. Now, if you're traveling, can you take those with you?
Oh, yeah.
Well, you said you have a carrier.
All the time.
But you can't keep them in the fridge.
No. So they're stable.
Okay.
We don't like to tell patients this because we want them to put it in the fridge.
Okay.
But they are stable in room temperature. It's just they degrade with heat. So
Okay.
you don't want them hot. And even if they're hot, they're still good. They're just not going to be as potent. So within a few days of being hot, it will break down. But if it's just a few hours, like say you're going to Europe, so it's 8 hours. If you have a cold pack in these little carrying case, it's still cool by the time I get overseas. And I pull it out and put it in the fridge, so it's fine. But even if I left a peptide out for a day, it's still stable. I'll use it.
Okay. Okay. So what are your top tips if you are interested in peptides and you're going to do them? Number 1, get blood work, right?
Absolutely. Get
And where do you start?
baseline.
Yeah.
See what you need. Do blood work and do a toxin test. There's so many different toxin tests out, So, and if you can't afford that, at least have your provider check your aluminum, your mercury, your lead, your arsenic. There is a lot of arsenic out right now in pesticides. It's in rice. It's in chicken, apples, of course, shellfish. So people eating your seafood, again, I do not eat it. Those are bottom dwellers. They have a lot of arsenic, mercury, and they have even some lead.
Wait, what kind of seafood?
Pretty much all large fish.
Large,
so tuna,
yes.
grouper, swordfish, but shellfish oysters, crab, lobsters. Those are supposed to be a delicacy, but they're loaded with toxins because they're bottom dwellers. So they're getting all the garbage from pollution on the bottom of the seafloor. And so I would have your provider at least do a blood test for those. It's covered by insurance. Big one I'm seeing right now, and I don't know where the hell it's coming from, is manganese. Manganese is in pesticides, but I'm seeing it. If it's a Quest panel, it's the mineral panel from Quest, you'll see it. And manganese will cause, if it's toxic, Parkinson's. So it is in pesticides, but I have patients that are like, no, I'm organic. We don't spray in the house. We don't spray outside. And they're still high. So I'm like, you're getting it from the air. You're getting it from some food item. Because there's a lot of controversy right now with organic. Have you been seeing that on social media?
I don't know. Like what? What are they saying? Just like that maybe it's not.
The drift. So something, it can be organic. Like, so you have like organic rice or organic wheat even. And they're finding like 1,000 times more glyphosate than there should be in the product because of the drift, and they don't have to claim that. So like drift meaning if I have an organic crop here, like on this farm, right next door is a crop that's not organic. When they spray, it's not like you have a huge greenhouse. It's just going in the air and coming over and affecting that. So,
I believe that. I have felt that firsthand. I've been in an area where there's a lot of farming happening. And I will tell you, I felt very like rashy on my skin and like tough to breathe. And I think it was from all the chemicals
it's in the air. Yeah.
Yeah.
And you can't be a bubble person.
No, you can't be a bubble person.
But that's why you want to have
Yeah.
some HEPA filters in your house, and constantly do like things to detox, like milk thistle or chlorella, cilantro. What else? Like shilajit is good. Binders are good. Charcoal. So when you feel that way, trouble with a binder. I like Cellcore has some really good binders that are a little more gentle. There's biotoxin binder. There's heavy metal binder. There's a bunch. And zeolite. Zeolite is another type of binder that will help bind those poisons. Some people, when we do genetics on a lot of people, some people have genes where they don't clear pesticides. And those are the people that have more neurological risks, like for Parkinson's or dementia. So getting back to
like the MTHFR?
MTHFR,
Okay.
but gosh, I don't have it memorized. There's a gene where you don't clear pesticide. So besides MTHFR, there's like COMT and MAO, but there's a bunch. I use something called MaxGen because it's $365. It's way better than Gary Brecka's panel. Like Gary Brecka's checking like just a few methylation things. This is checking 35 pages of your genetics, and then it gives you actionable steps what to do about it.
We talked about doing this.
Yes, you need to do it. So I wonder if you had that gene where you don't clear pesticides.
Right.
I have a gene.
I probably will have it.
Yeah, you might, which would go with
say.
autoimmune issues, right?
Yeah.
Because your immune system is going to be dysregulated if you can't clear toxins.
Yeah.
Because it's binding up the receptor, doing the wrong thing.
I think that's next. I think that test is probably next.
Yeah. So getting back to what you asked, so have your provider do a nice workup, see a functional medicine or longevity expert that's been doing it for a while. They didn't just take like a weekend course like you've got. So with experience, generally, I like to do that. Do a nice workup. Don't just do like your hormones. Check your toxins. Ideally, you would do a urine toxin test because it's going to show me more than the blood. The blood shows toxins for 3 months pretty much, and then the toxins go into the tissues and they're stored. And so then we have to do what's called a provocation test, where I give you a pill, DMSA, or an IV, EDTA. These are amino acids that pull out the toxins and then show me your total body burden of toxins for the past 40 years or so, versus the blood test is the past 3 months of what you've been exposed to. But you will see stuff in the blood test. So at least get the blood test. I would like to see a urine test. Like I said, I use the Toxin Zoomer by Vibrant Wellness. It's good. There's also a really good one from Doctor's Data that I'll do for heavy metals. And then I would probably say get on some basic supplements so they're going to work better. So get on a really good multivitamin, something that's GMP certified, so good manufacturing techniques certified, right? And third-party tested, so you have to be careful. Years ago, there was a big issue in Consumer Reports. They were showing, I'm going to pick on GNC, sorry. It was at GNC, and they're showing their supplements had nothing what the label said, and they had just rice flour in them. And so you don't know, what you're getting. So get a good quality multivitamin. Take a good quality fish oil that's purified, because especially if I'm telling you not to eat fish, right? So I like Orthomolecular or Zymogen, Metagenics, Thorne. Those are all really good brands that you can get online. So fish oil, a multivitamin, a probiotic for your microbiome. You may not need a probiotic. So if your stomach's great and you're pooping every day and your immune system's good, you don't need one. But if you're having issues, there's specific probiotics you can take. So
a lot of people don't poop.
I know.
A lot of people don't poop.
I don't think they're eating.
I'm shocked to know that.
They're not eating enough fiber.
Yeah.
And they're not generally.
I take my
they're low.
fiber in my shake.
Yes.
Well, and I eat a lot of fruits and vegetables too.
Yes,
but
you're very good, and you can
try.
tell. It shows in your skin. If you're not going to the bathroom, your skin's going to be more inflammatory. You'll have more acne. Acne is an issue with the microbiome. There's definitely hormones involved, but it's a gut issue, right? So I think those are the basic things they should do. It's get on some basic supplements. Take your vitamin D. I like D with K because it works better and it helps the bones and it helps get the calcium to go into the bones versus into the tissues when you take the K. But if you do that, check your blood, check your toxins, go on your peptides. I think you'll be pretty safe.
Okay. We could talk about this forever, but I love it. I think that's a good starting point on peptides. You gave us a lot of information. So
sorry.
No, you're an expert and I love it. And I'm so glad that you're here today because I just think there's a lot of noise out there. And I'll be honest, I've kind of been judgy on the whole GLP-1 conversation of maybe that's kind of an easy way out for people. And they don't want to change their lifestyle and they don't want to exercise and they kind of just want to rely on this one thing. But from what you're saying, it has to be, you have to change the lifestyle. You have to do all of that or else it's not going to be as effective.
Right. It won't work as well. It will work, but you will lose hair, you will lose muscle, and you'll lose bone density if you're just doing that and then eating your sugar and French fries and not exercising and taking care of yourself. But the people I'm seeing typically for weight loss have done everything. They're on hormones, they diet, they exercise, they're using even food delivery services, and they're still not losing weight. And I'll look at their hemoglobin A1C, which is a 3-month sugar marker, and they have insulin resistance. It's 5.7, 5.8, and their doctor said, "Oh, it's fine. It's close enough to 5.6." You want that level around 5 because if you have the insulin resistance, nothing is going to work, and you're at risk for a whole host of disease. Pretty much every disease, you could say, if you have insulin resistance. I think insulin is underrated. That is, if your insulin's too high, that is more important than having high cholesterol, insulin and sugar. And you'll see more and more data come out about that.
So interesting. Elizabeth Tringali, thank you so much for being here today. Tringali Vibrant Health. You're amazing.
Thank you. It's an honor and a pleasure. Thank you for having me again.
Thank you. Thanks for tuning into this episode of The Cinnamon Effect. If you enjoyed our time together, don't forget to hit that follow button on your podcast app and sprinkle a little love by leaving us a 5-star rating and a quick review. Your support means the world to me. For even more goodness, check out the show notes where you'll find links to some of my favorite products. And don't forget to visit thecinnamoneffect.com to connect with me directly or to grab your TCE Gratitude Journal, your next step towards a more grateful life. I can't wait to spice things up with you again next time. Stay vibrant, stay inspired, and remember to add a little cinnamon to your life every day.